Hi, Hadi.
Hello. Good luck.
Thank you. Hello, Ma. You're welcome.
Hi. Hello. Oops.
Hello, yes, I can hear you.
Okay, right.
You're welcome. Thank you for joining us.
Thank you to.
So we will wait a bit. Our next speaker will join us shortly.
Right, okay.
All right, thank you. Our next guest will be here in the next 2 minutes. Sorry for the delay. Is that Usman? Hello, Usman?
Hello.
Oh, okay. That's you. Welcome.
I'm so very sorry. Uh, I get you waiting.
It's okay. It's okay. So we'll be going on live, okay?
Okay.
With working on that. Yeah. All right.
Okay.
Sorry, I'm trying to go on live, but the network is fluctuating. Please give me a few minutes. I apologize once again, and thank you for your patience.
Okay.
Yep, we are live now. So I'd like you to show your videos, please.
Okay.
All right. So hello, everyone, and a very warm welcome to today's session. My name is Ajua Good, and I am the program coordinator for GAPhealth Technologies in the Gambia. So GAPhealth is a telehealth company whose operation extends across Ghana and the Gambia. At GAPhealth, we are passionate about using technology to make healthcare more accessible, efficient, and innovative, especially for communities that need it most. So through our GAPhealth patient and provider apps, people can book consultations like virtual consultations, manage their health records, and connect directly with healthcare professionals, all from their phones, both Android and iPhones as well. Our mission is to empower people to take charge of their health in a simple, practical, and an impactful way. If you'd like to know more about us or about what we do, you can visit our website at gaphealth.ai or connect with us on WhatsApp at +220 729 667, which is for Gambia, or +235 944 111 885. So before we hear from our speakers, let us take a moment to reflect on this conversation that we have today. Diabetes is a lung condition that affects how the body turns food into energy. Like normally our bodies use a hormone called insulin to move sugar from the blood into our cells for energy. But with diabetes, this process doesn't work properly. Either because the body doesn't make enough insulin or it can't use it effectively. So this causes high blood sugar levels, which over time can damage the heart, kidney, eyes, nerves, and other part of the body. Globally, diabetes is on the rise. In fact, the International Diabetes Federation estimates that more than 500 million people worldwide are currently living with it, and millions more are undiagnosed. In Africa, the numbers are increasing rapidly, especially in the Gambia that I know, considering I've been in the healthcare system myself, with a significant impact on younger people and working age adults. But here is what is important. Diabetes is manageable with the right care, lifestyle change, and support system. People living with diabetes can live healthily, full, and meaningful life. And that's why we are here today, not to focus on the medical aspect of it, but to hear the human stories of resilience, hope, and strength. Now it is my absolute pleasure to welcome our special guest speakers for today's session. They are not just patients, but voices of strength and resilience, and they're here to share their personal journey of living with diabetes. And they include Mrs. Monica Asedu, a former employee of the Soil Research Institute in Ghana, and Mr. Usman Sise, a global diabetic advocate in the Gambia. On behalf of GAPhealth, we are grateful for your presence and for accepting our invitation. And we would like you to please give us a brief biography or background about yourselves. Thank you. Mrs. Asedi, you can go first. You are muted.
Okay, can you hear me now?
Yes, I can hear you now clearly.
Okay. As you rightly said, my name is Monica. I have a Blankson in the middle, Blankson Asiedu. Formerly an employee, a retiree now of Soil Research Institute, and I was also the director of GAPhealth. You don't know that? Yes.
Yes, I did.
And so for now, I live in Benin. I'm a Ghanaian, but I live in Benin.
Yeah.
I've been here for almost 3 years and have 5 children. And now a single woman because the children are no longer with me. So I'm enjoying my life.
Right.
So
Wow.
that's all I will say about myself for now.
Thank you so much, ma'am. Thank you. Usman, you can go next, please.
Okay. Good afternoon, everyone. My name is Usman Sise. As I always introduce myself, a type 1 diabetes patient because I am a proud one. Because I was diagnosed 15 years ago when I was 11. So being a child, I didn't know nothing and everything. So that really gave me the courage and the passion of being a diabetic advocate, helping people about that. And now I am a graphic designer, poet, a writer, and a clothing brand owner here in Newcastle that resemble my diabetes life, and also a global diabetes advocate, being a voice for the voiceless, helping younger people that are living with diabetes to have a very fulfilling life, and also like having passion to be something else in the future. So that's all I have to say. Thank you.
Thank you so much, Usman. I have actually gone through your social media pages, TikTok and Facebook, and I've seen you've been doing an amazing work to sensitize or to create awareness about diabetes. And I've seen you with other patients as well, talking about diabetes, which is an amazing thing. You're great inspiration to everyone. And like I also miss talking about this as well. She's also the director, Mrs. Asedu. And besides that, she's also a great inspiration. GAPhealth is being founded by 2 visionary ladies. One of them is a Gambian by the name by Bintu Kaira, and we have the other by Mercy, who is the daughter of Mrs. Asedu as well. And they're inspired to come up with GAPhealth because they have family members that are diabetic, that have diabetes, and then they had to travel abroad to study. And at some point, they found it really difficult to support their family members to be able to manage their health. So that is how GAPhealth came about. Hence, they couldn't do it then. They want to, bridge that gap to help other people to take charge of their health as well. So thank you so much, Mrs. Asedu, for raising such an amazing lady who is trying to make healthcare more accessible to everybody as well. So, and thank you everyone for being here with us. So our discussion will last for about 15 minutes, followed by 10 minutes question and answer session with our audience. So to everyone joining us on Zoom and Facebook Live, we encourage you to share your thoughts in the chat, ask questions, and be part of this important conversation. This is not just a medical conversation, like I always said, it's human. Whether you're present, whether you're a parent or a healthcare worker, a student or someone living with diabetes, we hope you leave today's event better informed, more inspired and empowered to take action. Whether that means getting tested for it, raising awareness, or offering support to someone who lives with diabetes. So let's begin with openness, empathy, and hope. Without further ado, we will get started now. And the first question will be, could you please tell us like a little about when and how you were diagnosed with diabetes? Usman, you could go first, please.
All right. Thank you so much, Ayua, for that question. I think when we talk about diabetes, it's always very, very, very important. Okay. I can tell you the little about when and how I was diagnosed. I was 11 and I cannot remember a lot, honestly. And uh, my mom, who always tell me when we are diagnosed, this was going on and that, this and that. So I couldn't remember a lot. So, well, as he said, he told me that, well, I was someone very active. I always do exercise and so many other stuff, walking, running, playing with the kids and everyone. So there was a day I collapsed. And what she said, like, she was so frustrated that she couldn't even know what to do. So they took me to Cisse Kololi Clinic, Dr. Cisse, at Kololi Clinic. So where I was diagnosed. But like before the diagnosis, I went into diabetic coma for 5 to 6 days. Hmm? Okay. Okay. I went into diabetic coma for 5 to 6 days, and I was helped by Dr. Cisse, who helped me out. And I think I was having these complications, as he said. Most of the time at night, I do urinate a lot, and sometimes I urinate on bed. And I was sleeping with my younger brother, and I will urinate on the bed and push my brother on that side, and I go to the other side and change everything at night, my trousers and everything. And yes, as being an elder, like to being the elderly brother to my younger one, like me doing that was so embarrassing and stuff. So I have to change a lot. So that's what I know from my mom. Like the little that I know is that I cannot remember everything, but there's a little thing that I can remember, honestly. I cannot tell you that. But I always ask that question to my mom. How I was diagnosed, and when was that? It was in 2011, February 2011. So she cannot remember the date exactly, but like he said, it was around February 2011, meaning like it is 15 years now. And that is the only thing that I can say for now, because I have to be honest, I don't know a lot about my diagnosis because I was so very young and I cannot remember a lot. Yeah. Thank you.
Thank you so much, Usman. Even though you can't remember when, but you've gotten the important details, and it's gonna be really helpful to the audience. Thank you so much. So to Mrs. Asiedu, I hope I pronounced your name correctly, ma'am.
Yeah, you did. You did.
Thank you.
Okay, for me, when I was little, I remember my mother used to tell me to be careful with foods I eat, especially when I was on sweets. And, everything that was sweet, I loved. So she would say, be careful, because she told me she was diabetic, and she got it when she was pregnant with me. So I was always aware that I could get diabetes. She made me aware. But along the way, my mom died, and I was about 17, 18, and I think I lost track of the advice. And I realized when I was pregnant. I wasn't feeling too good with my last baby, actually. I wasn't feeling too good. And the doctor told me that I had so much water around the baby. So I had gestational diabetes. And for sure, I had never, although my mom was advising me, she had never taken me to the hospital to test whether I was diabetic or not. So it could be that even before then I was.
Yeah.
And I didn't know, you know. So I grew up, I had my babies, everything was fine. But with the last one, I got the gestational diabetes. And then I decided to go to school with the last one. When I had the baby, I enrolled and was in school. And I think the stress and moving up and down with 5 children and going to school, not taking anything, then get there, have some juice or yogurt, which was very sweet. So along the line, one day I was just standing by my car and I felt very faint going down. That's, I would say, about 20 years ago.
Wow.
And I just said, no, 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 there's something wrong with me. I got hold of myself, tried and drove to the university hospital, KNUST, as we call it, hospital. And there they said, oh, we have to give you Cipro and you have infection and on and on. I said, but I don't have infection. So I took the medication, went home, wasn't too good. So the next day I just took myself to the lab and did a lab test. I just went and told them I want to do test for diabetes. So the guy said FBS. I said whatever you call it. So he did it, and I was up on 18. And yeah, and I just took the result to the clinic, and the lady said, we have to admit you. I said, did I not come here myself? I'll report tomorrow. So they gave me, that's when they started giving me metformin, and there was no advice actually even to use diet. So that was me on metformin. So that's how I found out that I was diabetic. Um, Maybe, as I said, I had it before and I didn't know. Yeah, I didn't know.
You see, that's where the importance of family history comes in, especially when we visit the hospital. I think that is something that healthcare professionals should do all the time. Probably, yeah, they would have found out earlier. But what was your first reaction when you received the diagnosis? And also considering your mom had told you before that there's a possibility of you getting it, the fact that I've had it as well.
Very indifferent. I didn't really, because I knew that I could. So I just said, well,
Okay.
now it has come to pass, So I was very indifferent about it. I really didn't care that time.
Wow. So you were expecting already. And Usman, what was your reaction? I know you can't remember when, but do you remember the reaction you had? Hello, Usman. Are you with us?
Yeah, I have poor internet, so I'm trying to fix it up, but I think we can move on.
All right.
Yeah,
Thank you. I'm sorry about that.
yeah. I always have internet problems. So,
Right. So
what is it?
what was your first reaction when you received your diagnosis as a diabetic patient?
Yeah, I'm even laughing at that. But like, just as I said, I was so very young, and well,
Yeah.
I always talk to my mom because she's my best friend, and she was the one with me during my diagnosis and till date. Even today morning, she came to my room and asked me, "How do you feel? Hope you don't have low sugar level during the night and stuff." We need those type of mothers that can motivate us. She is the one that always motivate me to push harder, to move more. So the reaction that I had was, uh, she said, I didn't know nothing about diabetes because I was just a child, and I was having
Yeah.
dreams and so many stuff. So, but like she said, everyday insulin, pricking myself to test my levels. I do run away from home. Yeah, example, by that time I was not going to school. I stopped because I was
Mhm.
diagnosed and I needed a lot of attention and stuff. So I run away from home from 7 in the morning to 7 in the evening, and which was so crazy that well, I don't even remember doing that, but like that was it. And if they know that today I will be in this location, I will change another to another location the next day because they will meet me there. So the reaction was that like it was something that I'm going to live with it for the rest of my life. So the reaction will be okay. I am a child. I am young, and I have to prick myself every single day, not once, not twice, you know. And I also need to inject myself, not once, not two. So those things as a kid, it will always make you stronger. It will always be a courage for you to push more. So I think the reaction was uh, to be someone strong as a kid, helping my mom helping me aside. She really made me like a, a very strong person today. I think if you look at me today and if you hear my voice, you will know that, well, everything started with that. And I think that was the reaction of her. Yes. Thank you.
Thank you so much for that. So now looking back, like what has been the most challenging part of living with diabetes? Like I would,
Mhm.
Usman, you can go first, yeah.
Yeah. Okay. The challenges. Okay. I think I'm still living with those challenges. And personally, it was education.
Mhm.
Diabetes education was something that was really challenging because of what? Okay, Usman, you have diabetes. You have to inject yourself every day. But what am I going to inject myself? Tell me, what is this injection for? The insulin. So we have this fast acting insulin, the slow acting insulin. So before I was not having that knowledge, and education brings that. Like when you have the diabetes education, it really help you out. Okay, what is diabetes? Okay, this and this and this causes diabetes. But if you have diabetes, you have to do this and this and that. I think I was missing that a lot. When you go to the hospital, they will give you medication. Okay, the sugar is high. We need to do this. We need to do that. But you are not telling the person what he or she need to do, and that was really challenging. And today, when I read about diabetes, reading about it, and today at least being a young leader in diabetes on the IDF, International Diabetes Federation, it
Mhm.
is really a dream that, okay, I wasn't having education before, but I am doing something. I have the knowledge and I am teaching others. So it's a big challenge for me. And secondly, it's also the financial aspect. Okay. When you have about diabetes, you need to inject yourself. You need to prick yourself every day to test your level. Okay. As recently, I bought the AcuCheck Active test strips. It was costing $1,900 for 50 pieces. So I have to use 2 boxes for 1 month, and that will be 3,800, something like that. So the financial aspect comes in. The insulin. I need 5 insulins every month, yeah, something like that, because I use the fast acting insulin. Sometimes I will need 3 fast acting and 2 basal insulin. So that thing really helped me out. Like financially, I have to work. Yeah, because diabetes uh, affected my life physically, mentally, emotionally. It affected my education. It affected my social lifestyle, everything. Because before, when I go out, people will discriminate me. Okay, Kelly, from diabetes, that guy is having diabetes, this and that, and that misconception really was really a challenge too. So meaning we have the education, we have the finance, we also have the community, the society. But first, I would say at home, because at first, when I was released from the hospital, I went home and I used a cup to drink. Most of them were not using that cup to drink because they don't know what diabetes was. They were thinking that I will transmit that diabetes to them. When I use a cup to drink, they will not use that cup. When I sit to eat with them, because living in a family house, you all sit together and eat. When I eat, they will start to run away from me. And also when I use spoon, they will also not use that one. Hey, Usman was using that, so it's not safe, something like that. But those things were motivating me, okay, to change and stuff. I was young, but I have, I was intelligent. I was so very smart. You know, living with that life was so challenging, and it was so difficult. Yeah. So I think those are the three things that were my challenges. Very young, like education. I was not having the proper education of how to control and manage my diabetes, so that I can have a fulfilling life and a better life, that I would strive for everything. The second one is finance, because you need like a very good finance to take good care of yourself. You buy the insulin, you buy the test rate, you need to buy the vegetables, you need to buy the fruits, and everything is just expensive, like buying a Bugatti or Ferrari or Maserati. So I think it's so difficult. And the last one is the family, the community, and the society that we live in. I think those were the challenges that I really faced. Thank you.
Thank you so much, Usman. That was really sad, and I'm so sorry you went through all that. And you, Mrs. Asiedu, would like to hear from you as well about your challenges.
Okay, I agree with Usman that diabetes is very expensive to manage, very, very expensive. I'll talk about that. That's my first issue. I mean, before, as I said, I was very indifferent about it when I got it. I didn't really think much about it because I said, okay, diabetes, what next? And that was me. So in the beginning, I wasn't very concerned about my diet and, don't eat this, don't eat that. I was eating and taking the medication. And at a point, I just realized that there are times that my sugar will be so high, but I'll be moving around comfortably, no sign at all on me that my sugar is high, no fainting anymore. So my family was supportive. Nobody was shunning away from me. I was fine because I had my own family, my immediate family. I had my children, I had my husband, but nobody was thinking about diabetes on me. So that was the best thing that happened to me. But for the finances, diabetes is so expensive to manage. When you really want to live healthy, I think is the most expensive, very expensive. You go for vegetables, you go for your medication. If you have insulin, you are going for it, and they are all very costly. Those test strips for checking your sugar cost a lot. You think you buy the monitor and you think that's it, but the test strips are the worst to buy. And they will tell you that you have to keep on checking. And as he said, in the hospitals, I don't think they give much help in the hospitals, the doctors. I don't think they give much help. You go and they even accuse you that you are not on a good diet. When you are trying your best to live so that you don't die, a doctor will tell you, you are not managing your diabetes well. Why are you not eating this or that? Then that pisses me. So I wouldn't even go to the hospital. That was me. I wouldn't go. I would manage it myself. And managing it myself, I don't know if I did well or not, but my sugar was always high. Every time my sugar was high. Because you go and they'll tell you, take metformin 50, 500. You'll be taking it. You go, they'll check you again. And they'll say, take metformin 50. I was taking Galvesmith. 50,000. They have increased it for you. And you keep on taking it and it's not working. And nobody is telling you anything. They will say, okay, exercise and do what? So now we are fortunate there is social media and people are writing a lot about diabetes. So you get to know that this is what you have to do, that is what you have to do. But before, it was very difficult. My mom died at the age of 56 because I think she was just taking the metformin and not managing herself very well. So for me, the finance is a big problem. Now, if I tell you the medication, the cost of the medication, I mean, you open your mouth. That's Usman was saying. It's not right. And you don't get any subsidy for good medication. If it's just the normal metformin, you'll be fine. But you don't get any good medication to take. So you go and they give you metformin and you come home, you take it and it's not even working on you. And also, I also blame myself or the medical field because they didn't test me to know that I was type 1 or type 2. They just started giving me the drug. No lab work.
Wow.
You know, they apart from the one that I did, nobody else will do any lab work on you. Because I don't know if they think you don't have the finances or I don't know what it is, but if you are not lucky, you don't go to a private clinic, the lab work is not really an open thing that you get to do. So with the diabetes, it entails a lot. You have to check yourself really well. And in the beginning, I wasn't doing that. I thought in my mind, I thought the medication would help, but it's not just about the medication. So the medication I didn't know about, I was just taking it, not much about it. And then I will spend a whole lot of money buying. For medical oil, things like that, no, there was nothing like that. It's just that it's very expensive to manage. And if you go down on health, you just go down. If you are not careful, you just go down without even realizing it. So that has been my challenge.
That was
That's
a
it for
lot.
now. Thank
And
you.
thank you. That was really informative. And honestly, I've come across people like that. They would literally complain that I'm not going to take this medication anymore because each time I take this medication, this is how I feel. And it's like they literally don't know why they're taking it and what they should expect. However, I also like to talk about GAPhealth. We also have a new platform that is purposely for diabetic patients. I had talked about why GAPhealth came into existence. So in that app, patients are given the opportunity to check their blood sugar, and you get to input that as well. You get education on your diet, on diabetes in general. You get to put in your blood pressure. You book consultation with a professional, a healthcare professional, where they will advise you on what to do. They could actually they'll prescribe medication. And in that, you get to know why you're taking the medication, what the medication it is, what it is exactly, why you're taking the medication, how long you're supposed to take it, the dosage of it, and the indication of it, the side effects that you're going to experience. I mean, with this, you're going to have an idea about what is happening to you and what to expect. So I advise everyone to please go ahead to reach out to us, or you can also check our website at GAPhealth.ai. And I would also like to ask about like what role does the diet play in your management as patients, and how do you approach healthy eating as well?
Do you want me to answer that?
Yes, please go
Okay.
first. Lucy,
Okay.
sorry.
So I can tell you I've gone through a whole lot of diets. I cannot even count. I was on, that's recently though. Before I didn't really mind. I was eating a lot of vegetables though. I would eat a lot of salads, but add a lot of carbohydrates to it. I would eat my sauces or my stews, Ghana made way, which has a lot of oil. And I thought that was it. I'm eating my vegetables. But somebody put me on a diet, And I think that was very, very helpful. I used to have fatty liver also. You know, diabetes comes with these things, fatty liver, and it's so bad. Yeah. I had it for a long time, but this friend of mine, she put me on a diet that excluded fat, any form of fat, and any meat sauce, meat, any kind of meat. So I was just doing vegetables. So I was doing the vegetables just with sauteed onion in water and then add tomatoes and put my vegetables in, and I can eat whatever carbohydrate I want to eat. I did that for 6 months. And she would advise me to eat raw veggies, raw, like cabbage. You know, this they say cruciferous vegetables like cabbage, Brussels sprouts, broccoli, cauliflower. So those ones I would steam, but with the cabbage, I would eat it raw in the morning before I eat anything. Then I'll have my oats, and I have the oatmeal, and then I was making my own milk and everything. She made me go off processed foods. And for 6 months, I was doing that. And it did help me. It did help me. The sugar was being controlled nicely, but it got to a time, I don't know what happened. It just triggered again. And that's diabetes for you. The sugar started rising again. So if you are able to maintain that strict vegetable thing, it helps. It helps. But I don't know if you can do away with your medication. That one, I don't think so. I don't think so. Right. But it helps to eat a lot of vegetables, especially the raw one like cabbage or lettuce, a salad. It helps a lot. And recently, my daughter put me on another diet that was not eating carbs in the evening, just going on to maybe chicken breast or tuna or sardine, something in a salad, but no carbohydrates in the night. And that also helps. So these are some of the things. So I have gone off my normal Ghanaian food, and I'm doing this vegetable thing, although not very strict now, but I still manage to do my stew without much oil. Ghanaians will pour oil like that and start with the onions with a lot of oil and continue cooking. But now I don't do that anymore. And I think it's very helpful. The last time I checked, I didn't have fatty liver anymore. And I think the diet has helped me. It has helped me. So it's good to do a lot of vegetables in your food, a lot of vegetables in your food. Even chewing on cucumber also helps. It also helps. So that's what I've been doing. And for some time now, my sugar is being controlled. Yeah, thank you.
Wow. That's really educative for the newly diagnosed people, patients, for them to, learn from you people. What about you, Usman? Please share your own experience.
All right. Thank you so much, Mommy. I've learned something new today. But personally, as a type 1 diabetes advocate and also a victim of it, the diet is the key to diabetes management. It's the most important thing when managing and controlling the sugar levels and everything. Because here in Gambia, we don't have that type of foods that you can eat that you don't need any, because I am insulin dependent. I inject insulin, and personally, the diet, what I learned, it led me to go to NANA, National Nutrition Agency, and also there's an institution named Africa Catalyzing Action for Nutrition. I attended a training with them on how to eat good food, meaning a balanced diet. So knowing that I have diabetes, I have to know what to eat. And whenever I give my diabetes education, I give them these three things that is very, very, very important. What to eat, when to eat, and how to eat. What to eat. it's very important, the type of food that we need to eat. I also learned that like we have these carbohydrates, we have it in two forms. We have it in two for simplest form, that is fructose, galactose, and lactose, and those are very important things. And in the other form, you call it as starch, meaning the rice, the bread, and what we call chere in our local language. Chere, I don't know the name in English, but I think chere, we all know it. Okay, so before I eat a lot of chere because I really, really love chere. Even as of now, I was even eating chere before coming to this event. You know, like it is my best food, honestly. But before, I was thinking that like it cannot raise my sugar level up. I was eating a lot, morning, afternoon, evening, even at dawn. I eat a lot of cherry. But after attending this training, I learned that cherry and that bread and that rice, they are all starchy. They raise the sugar level high. I was saying, no, this is not possible because I was killing myself with that cherry, leaving the rice and the bread, but they are all the same. So I also learned that we have certain foods that we don't need any insulin for that. And that is the vegetables that mommy was just talking about. The vegetables is very, very, very important. So having the cucumber, the salad, the tomato, mix it with a little bit vinegar and so many stuff. And we have foods that we need no insulin for. That is the beans. Yeah, because whenever I eat beans, I don't inject insulin for it. It doesn't raise my sugar level up. We also have the chicken. We also have the beef. We have the fish. We also have the egg. So we don't need no insulin for that. So I I learned about it, and I test myself on that, and it doesn't raise my sugar level up. I think okay, this is the best food that I can eat. And too much insulin is also not very good in the body. It can lead to late complications. I say, okay, this is the system. But in Gambia, we do one thing every morning. You need to eat rice or bread for breakfast. And in Gambia, if you don't eat rice, then you don't have lunch. Even you can eat a whole bowl of other foods, but when it is not rice, then you don't have lunch. And at night, you also eat rice or bread for dinner. So meaning the routine, the sugar level will not be normal. And you thinking that you are the one,
Yeah.
but unfortunately, in the next 5 years, it will start to affect your your organs. So that is the thing, and it is very important in diabetes management and control. The food is the key in diabetes management and control, and it is really, really important knowing what to eat, when to eat, and how to eat. So it's very important. But before that, I always advise what I educate the young diabetics is that you have to test your sugar level first before eating a certain food, no matter if you need insulin or not. Because when it is high and you eat another food, then the sugar level will go up again. So I think it is very, very, very important. And uh, diet will play a very important role in the future if we have this education on diabetes. Mom, I think we need to talk about that today. The education is very, very important. Yeah, because we need to tell people that, okay, like when you have diabetes, it doesn't matter what type of food. They will advise you, even doctors or nurses sometimes, they will advise you to eat a certain food, and they will not know how that food will react to your body because people are different. Maybe when I eat this food, it will not affect me, but when others eat it, it will affect them. So we need to make them understand that it is your body. You have to know how it will react in your body. And I think that's all what I have because diet is the key in diabetes management. Thank you.
For me, I would advise all healthcare professionals to listen to their patients first because you have more information than the healthcare professionals. It's just about what they've learned and you are actually experiencing it and you've tried different routines and you know what works and what doesn't work. So I hope we would consider that, healthcare professional would consider that as well. So I would like to know, like, what tools, devices, or apps do you use to help you manage your condition effectively currently?
Okay. With that, I think I'm going to start. Oh, mom, we're going to
Yes,
start.
go ahead, please, Osman.
All right. The tools or apps or any device that okay. Last year, my birthday is on the 7th of November because November is the diabetes awareness month. And I was born on the 7th of November. So 7 plus 7, it is 14, and 14 is the World Diabetes Day. So meaning I was born to be a diabetic, and forever I will be a diabetic. So that is why I was born in November. So like there's a friend who gave me a birthday gift all the way from Germany, and it was this CGM, continuous glucose monitors. Like it is called Freestyle Replay 3. Like that really make the diabetes management easy for me. By that time it was in November, and it was 5, and it works for 14 days. So I used everything, and I was saying, okay, do we have this in Gambia? I think we don't have this in Gambia. So the tools and everything, like, yeah, so it was really crazy. But actually I downloaded the GAPhealth application, but I cannot use it as I want it to be used, because personally I was using my sugar application. Okay, I connect it with my machine. Whenever I test, just connect it through Bluetooth, and it will, like, I was having everything on my phone. Sometimes, like, I don't need the machine to check about my last readings, the memory and stuff. I have everything on my phone. I think, yeah, those were the devices and the tools that help me manage diabetes effectively. And I think we really need that freestyle diabetes in the Gambia. And if GAPhealth can help with that, if we will be really, it will be really great, and we will appreciate that. You can bring it in the Gambia here.
All right, Mrs. Asedo, you can go next, please.
I also used the continuous monitor, but I don't know if it was a good idea, because you know, it's this patch on you, and it goes on your phone, and every, is it 3 minutes, 4 minutes, is beeping. When your sugar goes high, it's beeping, and it was a bit frustrating. I used that for 4 months, and I I went to the hospital, and they asked me if I was using that. I said yes, and in fact the doctor said no, don't use it. Don't use that one, please, because it's sort of you get a bit depressed. That's how I felt. That every time my sugar was up, every time my sugar was up. It's good because you are able to check it, and it draws a graph for you. You know how your sugar is going, but you are, and it got to a time I couldn't even eat, because I felt that when I eat, my sugar would go up. So I was like, I don't want to eat. I don't want my sugar to go up. So that's how I felt. So I stopped using it. So I just used the glucometer to check it. And even that one also, you know, you have to always put needle and then check, and you find your thumb or your fingers hurting. So when I want to know the trend, when I change my medication, I use it very often. But after that, when I know the trend, then I reduce it to maybe 3 days, 4 days before I check the sugar, because I know that when I take this medication, it will help me. One thing I also realized about talking about medication is I use Gavesmith, but I traveled to Kenya and bought the same Gavesmith there, and I realized that it worked better. I don't know if it's just my mind, but I looked at the back of the box and realized that ours was coming from, the one I use in Ghana was from Zambia. The same company though, and the one I bought in Kenya was from Switzerland or Germany. And when you take that one, I tell you, the sugar just dropped from my 200 and 300, bam, down to the hundreds. So I went round the Ghana pharmacies, and I was wondering what was wrong before I realized that Zambia was written at the back of the box that comes to Ghana. So I just want people to note also what they buy. I don't know if it was just by chance that it went down or what. I don't know. But even recently, because there I bought just one box. It got finished and I switched to the GAPhealth in Ghana again, and it started going up. It started going up from 120, 122 to 160. And I have my data on my paper here. So I was thinking, what is wrong? So you check your sugar, all right, but the medication also, I think, should be noted that some of it doesn't work for some of us. Some of it doesn't work for some of us. We have to note that. But I just read a lot on diabetes. There's a lady who I usually use, I've forgotten the name, but I listen to her a lot on diabetes also. So I get some information as to how to manage it. So these are the things that I use. But I think despite those things, the medication is also a key factor. Thank you.
Thank you, ma'am. So I remember sharing a survey question to both providers and patients as well regarding our diabetes app. We don't just want to push it to our patients just like that. We want to hear from you people. We want to know your experiences. We want to know what you need that is gonna help you to manage your condition effectively. I remember sharing it with Usman as well, which I'm gonna do with you, Mrs. Asedu, as well. And we are also going to share it on our social media pages so that we would hear directly from patients themselves. Yeah. So regarding the notification, like currently we are having a partnership with university, where, when their patients' pressure is high, they get a red alert, and the doctor is also notified, or they're told to, reach out to a provider. So I think, Ms. Carol, we're going to consider doing that for diabetes app as well. So we're gonna consider doing that so that it's gonna help you patients to manage their condition effectively. Yeah. So I would also ask this question, like, could you kindly share your experience with doctors? I know you've made mention of you, or providers in general, like as someone who is living with diabetes, like, do you feel supported when talking about your health or managing your condition? Yes, Mrs. Asili, you can go first. I keep forgetting I have two speakers today.
Supported by the medical practitioner, or what are you talking about?
Yes, supported.
Oh, okay.
Yeah.
I don't know if I should say supported. I don't know even if they listen. That one I'll tell you. I don't know if they listen to us. I think they should listen to the patients more.
Right.
It's not okay to just prescribe. You just check the person's sugar and you prescribe medication. It's not okay. It's not okay like that, because the person might be having issues, and maybe, I don't know, maybe they'll tell us that they cannot, it's not their, it's not what they should do as practitioners. But I feel that as a medical doctor who specializes in diabetes, the person should have patience for the patient, because already the person might be depressed from, the sugar going up and up and up and not being controlled, confused as to what to do. And you go and you are just giving medication. They won't even listen to you to hear, okay, the medication I'm taking is not helping me. Okay, go and take this, and they write for you. And they won't even explain what that medication is going to do for you or to you. So I think doctors should be helpful and have a ear for patients, listen to them, see how they feel before they do their prescriptions. It will help patients a lot.
Right.
Thank you.
Right, thank you. What about you, Usman? Do you feel supported when you see a doctor or any healthcare professional?
Okay, I will just tell you what is in me. I don't feel supported, honestly. Yes, because if I can tell you something, a story, it's just a short story about I and nurse at Banjul because I am using the fast acting insulin. It is named Novorapid. Yeah, that is my insulin. So in Gambia, mostly we have the mixed out insulin, which is working for 12 hours. And the fast acting insulin is working for 3 to 4 hours. So difference between 12 hours and 3 to 4 hours, there's the huge gap there. So I told him that, okay, this is the insulin that I inject. So can you please help me use this insulin for now? And you will see, because I asked him, do you know this? And his reply was very clear. No, I don't know it. I also asked him, do you know how many hours is the mixtan working in the body? He cannot tell me something that I can hear. Meaning like they are not having the education on diabetes and they want to help a diabetes patient. I think that is not possible. Yeah, because it's very important. Okay, just wearing the uniform doesn't mean that you know everything. Sometimes the people living with that condition can give you the knowledge that you need, and you can also help other patients some other time. So I think it is very, very, very important for them to listen to us. And sometimes living with diabetes doesn't mean that I don't know nothing about, because every single day I read about my own personal story, because I write everything in my laptop and everything. I always read about it and I always feel happy. That always motivate me. And I also think about it. When you need something, I can tell you, because I've been in so many trainings. I've represented Gambia twice international. Like I've had something very, 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 very serious on my diabetes management control. I think it's very important you listen to me. I know my own body. If you give me a medication, I know how that medication will react in my body. I cannot take all the medication that I don't know. I think first thing they need to listen. They also need to hear from us. Let them help us, because they are professionals. We are not. We are just patients. We are just victims living with that. I think it is very important they listen to us and they give us the love, the support that we need when we visit them in various hospitals. Yeah, that's what I have to say.
You are actually professionals in your own condition. I would say most of the times the patient knows better than the provider when it comes to the condition that they have. And I always believe in involving the patient in making decisions, ask them what has worked, what has not worked, and what do you think of this? Yeah, that is right. And we look forward to having healthcare professionals here too, to discuss this. And we will definitely ask them this question and how they can improve on it. Yeah. So have you found strength in connecting with other people living with diabetes? Yeah. You can go first, Usman.
What's the question again? Sorry.
Hello?
What is the question again? Sorry. Uh-huh. I cannot get you. The internet is slow. I'm not getting you.
I'm muted, sorry.
Okay. Okay.
My question was, have you had the chance, have you had the strength to connect with other diabetic patients? And how has that helped you as someone living with
Yes.
diabetes?
Yes. I think that one is one of the things that I always do every single day. Just before this meeting, I just met five of them, and the youngest was 5 years old. And like I was really helping. I was really helping with the education. like making them feel that, okay, having diabetes doesn't mean that your life is ending so soon or stuff. I think it really motivated me to be the best version of myself, to be the best person that I can ever be. It's really, really, really important. Like seeing someone that is having the same thing as you, that is living the same life as you. Well, as I always say, as I always say, the difference is we, the diabetic patients, are living our life as others. And the only difference is we are doing the work of an organ. The pancreas is no more releasing that insulin that we need. So we need insulin to replace it as a substitute. I think it is the best thing. And, connecting with others, like I cannot even know the words that I can put in to I always feel good being with diabetes every single day. It will always push me to strive and be the person that I want to be every single day. I think it is very, very, very important. It is very, very, very important. Like seeing people, especially for me. I love kids. I love kids a lot. Seeing kids with diabetes, I always want them to stay with me for the whole day, talking to them, explaining to them, feeling the love, feel like, especially when we have to eat, we all going together, having the same insulin together, but different when you see other people. Okay, you are the only one that will inject insulin. I just today I'm not going to enjoy this food because that's it. But when you see people living with diabetes, eating the same food, injecting insulin together, doing a lot together, for example, you know, you will feel something that you not even imagine, and you don't have any words to put in just to make it clear. And I think it is really, really, really great, honestly. Yeah.
Thank you so much. That was really educative. So I'll throw it back to the audience. Does anyone have a question for our speakers before we wrap up? Any question from our audience?
I'll go. Thank you very
No?
much, Joel, for
Okay.
hosting this event. And thank you to Usman and Mrs. Asadu for sharing with us today. Definitely been taking a lot of notes on like GAPhealth, but my own personal knowledge as well. And we're hoping as people learn, they can share with one. They say like learn one, teach one. But I wanted to ask more from like an open conversation, open question to Usman or Monica. So if you had a magic ball and could make a change in diabetes, what do you hope that is?
Okay. I will I will answer that question, and please, when I answer that question, just know that it is something that I mean. Okay. I want to inspire the world, yeah, through diabetes. And even in the next world, I want to be a diabetic. I'm telling you that today. So that is my answer for that question.
That's amazing.
I differ. I beg to differ. I don't want to be a diabetic in my next world. But I don't, because this is something that restricts you in your life, and I don't know what to say that you really don't enjoy yourselves. As a diabetic, I think for me, I wish there'll be a medication or something that would can cure it. If it's there, there should be a medication that can cure it. You hear a whole lot of things online that it can be cured, use this, and it's all a lie. I've tried much. It's all a lie. But I wish that somebody will come up with a medication or something that can make it curable. That's what I wish for. Because it doesn't give you a pleasant life. It doesn't. You see food and you cannot eat. It's very, I don't know what to say, but that's how I feel. You see something that you really want to eat and you just cannot eat it. So that's me. There should be a cure.
Thank you so much. Thank you
you.
once again for being part of today's important conversation. And on behalf of GAPhealth Technologies, I want to express my heartfelt gratitude to Mrs. Monica Asedu and Mr. Usman Sise for sharing their journeys with us. So your honest courage have given us a deeper understanding of what it truly means to live with diabetes. To everyone who has joined us on Zoom and Facebook Live, on behalf of on the GAPhealth Facebook page, we are deeply grateful for your time and your questions and your presence as well. Today reminds us of in raising awareness. It's not just the first step, it is also a vital step towards changing our lives. So as we leave this space, let us carry the message forward. Let's encourage early testing, push for better treatment and care, and make informed choices for ourselves, our families, and communities. And also to the providers, please help in giving the right information to our patients. So if you would like to get connected with us, please reach out. Please visit our website on GAPhealth.ai, or you can reach out to me on WhatsApp +22072979967. So once again, thank you for being here together. Let's keep working towards a future where healthcare is more accessible, innovative, and inclusive for all. Stay safe, stay informed, and let's keep inspiring one another. Thank you. Have a wonderful evening. Bye.
Thank you too. Bye.
All right.
Thank you very much.
I'm ending it.